In box D, you have students that are not at risk who passed your test. And that box D is true negative. So in your screener, what you'd like to ideally have is only students in box A and box D. You want your at-risk students who fail your screener to be a true positive, and your not at-risk students to pass your screener and be a true negative. So when you take all of this and we look at screeners, then we can talk about how effective your screeners are at identifying who you want them to identify, essentially. So how were students identified? What's within those screeners that you use to determine who's at risk and who is not at risk? This slide just shows how we have some different things that are used within those screeners. Sometimes they use cut scores, which means at or below a certain raw score. If a student falls below this score, they're at risk. If they're above this score, they're not at risk. Percentile ranks is another way that we identify at-risk students. So all students below a predetermined percentile are determined to be at risk. So for example, if you look at our MAP assessments, you could say that all students that fall below the 25th percentile are deemed at risk for falling behind their peers or having a learning disability. The last one there is a performance standard. And a performance standard is the severity of academic difficulty. Essentially, you look at your grade level performance. So you have third grade students and they need to read 70 correct words per minute at the beginning of the year. And this could be according to DIBELS, it could be your state standard. If they don't hit that 70%, if they don't perform to that standard, then they're deemed to be at risk. So any combination of these, depending upon which screeners or subtests you use, can be used to identify what students are at risk. The guidelines for selecting screener assessments. The first thing that Pat Scher, Youngsuck, and Foreman talked about was that you have to be able to define what at-risk means for you within your district. And along with what at-risk means, you have to have an idea of what your gold standard is. So what is it that every student should be able to do, and at what point in the achievement or in the goal do you say, oh my gosh, these kids aren't making it, they're really at risk. So that could be a cut score, that could be a percentile, that could be your state benchmarks for fluency or comprehension. The second point there is using the process of screening, but having a specific goal for your screening process. So are you screening for fluency? Are you screening for comprehension? You want to pick a screener that matches the goal of your screening process. And along with the goal of your screening process, you have to look at whether you're going to use a screener that does multiple measures or one that just looks at a single measure one point in time. So multiple measures would be at the beginning of the year you give all your kids the DIBELS assessment, and then you look at those students who fall within that possible risk area and you monitor them every 2 weeks for 6 weeks. And then you use that progress monitoring to determine. Or multiple measures can also mean that instead of just giving a DIBELS assessment and looking sheerly at their nonsense word score, that you look at their nonsense word score, their letter naming fluency, or their phoneme segmentation fluency, versus a single measure, which is where you would do that just one. So you're only going to look at their nonsense word fluency. Multiple measures are usually more accurate than single measures are for identifying students that are at risk. But sometimes you end up with so much data that it can be hard to put all the information together and come up with a clear cut what is at risk and what's not at risk. It just becomes a lot of information on your plate that can be hard to deal with. The last one down there talks about false positives and false negatives, which is always something that you want to take into consideration when selecting screening assessments, because you want to use your resources without wasting your resources. So if you end up with a lot of individuals who fall into those categories where they're not at risk but they failed your assessment, so you're treating them as if they are at risk, it's a consideration that needs to be made. This next slide talks about providing instruction, and there are different approaches to provide instruction within RtI. There's a standard protocol approach and the problem-solving approach. The standard protocol approach has some basically it's that you group students together that have similar difficulties, and they're given a research-based intervention that has been standardized and proven effective for students with similar difficulties, and you give it to them for a predetermined amount of time. The problem-solving approach, which is a little bit more individualized but can be, done in a group, is where you look at the problem that your students are having. That would be your step one, or step two would be to kind of analyze the problem. Then you would plan the intervention, you would implement the intervention, and after you've implemented it for an amount of time, 6, 8, 12 weeks, depending upon your tier, you would go back and you would evaluate your progress. A lot of states, Washington State included, often use a combination of these two approaches that Berkeley et al. Referred to as hybrid combinations. It's kind of taking the best of both worlds and putting them together based on the needs of your students, the abilities of your students, the resources that you have available, those kinds of things. Progress monitoring is included in here. Once you've placed your students in whichever tier they're in, like I said previously, the point of RtI is to give them interventions, a strong, shot of exactly what they need to boost them back up to meeting standard. So if you place a student in a tier 2 or in a tier 3, you want to make sure that you're monitoring them and collecting that data to decide if you need to make a change in either your curriculum, the materials, the instructional approaches, the frequency which you're giving the interventions. Abbott and Willis talked about how this whole concept of progress monitoring, and really RtI as a general, has to be viewed as a team decision. You can't have just one teacher in a room who progress monitors and then decides, well, this kid no longer needs 2-tier interventions, they need tier 3 interventions, or this kid no longer needs tier 2 interventions, they can go back to tier 1 interventions or general education curriculum. That it really does need to be a whole team of people who all come together and assess what exactly that data that progress monitoring has provided you, what it really means. Our last page here, or last slide I believe, talks about identification for special services and how it can either replace, in some states, and or be used in conjunction with the discrepancy model. And the discrepancy model is when an IQ test is given and an achievement test is given, and you can put a student on an IEP, provide them with special education services based on them having a discrepancy between their IQ or their ability level and their actual achievement. And in most states, you have to have a 15 or 16 point difference between those. So this RtI process can replace that. In some states, it wholly replaces it. In our state, you can use either model. You can also, in Washington State, students are monitored, and the OSPI recommends that districts use this diagnostic model that requires students to progress through all the tiers before special education is considered. So in some states, like I think it's Ohio, a student who's in a response to intervention model can be referred for special education in Tier 2. They don't have to have the interventions at Tier 1, Tier 2, and Tier 3 before they can be referred. However, in our state, students are required, or I shouldn't say required, it's recommended, and I know in my district that it's required that students go all the way through that third tier before they're referred to special education. We want to try everything we can to provide them with those interventions to be successful before placing them into that category of having a specific learning disability. And then basically the overall identification for special services is that when you look at those students, in order for them to be able to qualify, they have to be low achieving and they have to have slow growth. So if you have students who are low achieving, but their growth rate matches that of their peers, then they're not going to qualify through RtI for special services. Also, if you have a student who's a real high achiever and they have a slow growth, they're not going to qualify either. Our last slide talks about the key components of successful RtI teams. These components were recommended from the research article written by Abbott and Wills, and I really liked how they kind of summed up how an RtI model really revolves around a team, that these components will help a school be successful. The first is to organize a team, not just to, pick a couple people and put those 3 or 4 in charge of it, but that it requires a whole team that has the power to create, implement, and maintain the comprehensive change plan across all the grade levels. That the schools, the teams, they need to own the data instead of making excuses for it. They need to acknowledge that the data is coming from the students who are responding to the interventions that are being done in their classroom. Also, that in order to have successful RtI teams, you have to maximize small group and universal curricula by encouraging that mastery of learning, implementing appropriate error correction, building in frequent opportunities to respond, and increasing read aloud time if you're implementing RtI for reading. Also, they have on here involving all staff members. So making sure that you're finding a creative way to involve every staff member possible, including your music teachers, your PE teachers, your administrative assistant staff. As many hands as you can get involved, the more people who are on board with the program and support the program, the more successful it's going to be. And then the last one there is creating a cohesive RtI team that becomes kind of the school's academic problem-solving body. And I like that idea of having the team to go to when you're having those struggles. So even if this, it's not a time frame that's been allotted for the student's progress to be discussed, that you have that, problem-solving body that you can just take your information to that will help provide you with some guidance or information. And that is the end of my presentation. Thank you for watching.